What would you do if your skin on your face started to become thick, tight, and your mouth narrowed to the point where you would look like a mouse? This woman suffered from systemic sclerosis. She was a beautiful, happy woman who sadly turned into a woman with low self-esteem. This disease is affecting mostly middle-aged women, and it all began when her CD4 T helper 2 lymphocytes reacted against some antigens in her body. These lymphocytes started to accumulate and release cytokines, which eventually led to vascular injury, especially on her small finger vessels. The damaged endothelium produced less vasodilators like the nitric oxide and produced more of the vasoconstrictors like endothelin-1. You can imagine what this led to. It led to a vasoconstriction, which caused tissue hypoxia, meaning that the oxygen supply decreased. The damaged endothelium also released platelet-derived growth factors and transforming growth factor beta. And these two agents together with the tissue hypoxia attracted and activated fibroblasts. These activated fibroblasts started to produce a huge amount of collagen and extracellular proteins. What happens when you have an overproduction of collagen? Fibrosis happens, and in her case this means that she got fibrosis in both the visual organs, skin, vascular system, and the small vessels in her hand narrowed, which led to ischemic injury. Her symptoms all began with the swollen fingers in her hands in a symmetrical fashion, meaning that both hands were affected. She noticed that her skin became firm and thick. It began in the hands and then moved up proximally to involve the upper arms and shoulders and neck and face, trunk. So on her hands she noticed that her fingers became white and then blue when it was cold or when she was stressed. Then when she warmed her hands they became red instead. So this is called Raynaud's phenomenon, which is a vasculitis of the small vessels in the fingers which narrows them. So how do we help her with this problem? We tell her to stop smoking, since smoking narrows the blood vessels even more and makes it worse. We tell her to dress warmly, especially protecting the hands and the feet. Staying indoor during cold weather is also an option. Calcium channel blockers like nifedipine can help in opening up the small blood vessels and thereby improving the circulation. Some fingers lost blood supply, unfortunately, which led to fingertip necrosis due to this digital ischemia. It became so severe that ulcers appeared and some fingers even got auto-amputated. We have to treat her digital ischemia with some vasodilators that increase the blood flow, for example the intravenous infusions of alprostadil, a prostaglandin E1, or with epoprostenol, a prostaglandin I2, also called prostacyclin. So her fingers also became tapered, claw-like, also called sclerodactyly, which is a flexion of these proximal interphalangeal joints. On her nail falls, the capillary loops dilated and some loops even got lost. This was confirmed with the microcirculation microscope. She started to have calcific deposits breaking through the skin, also called calcinosis cutis, which is a dystrophic calcification of subcutaneous tissue. So these can be found on the hands, face, trunk, and the skin above the elbows and knees. The face became tight like a mask with radial furrowing around the lips, which made her mouth opening smaller. And this makes it hard for her to take care of her teeth. Furthermore, in systemic sclerosis, there's connective tissue damage in the mouth which can lose the teeth. So she also noticed some telangiectasia on her face, which are small red spots caused by the swelling of these tiny blood vessels beneath the skin that can be eliminated by guided lasers. We can also see epidermal thinning with loss of retipex and dermal thickening because of increased amount of collagen fibers. When too much collagen fibers builds up in the skin, it crowds out the skin appendages like the sweat and sebaceous oil glands. This is what leads to the dry and stiff skin. So what we can do here is to apply oil-based creams and lotions frequently and always right after bathing. We should avoid the hot showers as hot water dries the skin. So we can apply sunscreen to protect from sun rays. Exercise regularly like the swimming to stimulate blood circulation to these areas. So until now we know that increased collagen production can affect the skin, but what about internal organs? The digestive tract, heart, lungs, kidneys, muscles and joints can all be affected. In the digestive tract there can be collagen deposition in the walls. The collagen can damage the walls to the point where air enters, causing pneumatosis intestinalis, which are gas cysts in the bowel wall. This can be seen radiologically. What parts of the digestive tract can be affected? Esophagus, stomach, small and large intestine. In the esophagus we can see esophageal strictures. In the lower two-thirds, the collagen deposition in the wall causes absent peristalsis, which leads to dysphagia. That means difficulty swallowing both solid and liquids, or hardly swallowed actually. The esophageal mucosa may become thin with areas of ulceration. The lower esophageal sphincter may lose its function, which is to close the connection between stomach and esophagus. It's important because otherwise the acid of the stomach may enter into the esophagus, leading to gastric acid reflux, causing pain named heartburn. The wall of the esophagus is not used to be in contact with this acid, so if reflux happens, then the wall of the esophagus changes its structure to be able to resist this acid. And this change called metaplasia. So squamous epithelium becomes columnar epithelium instead. And now we call the esophagus Barrett esophagus, which predisposes to adenocarcinoma. What happens with the stomach? The same story here, that the collagen deposition in the wall causes less peristalsis, or also called dysmotility of the stomach. This leads to postprandial bloating. You know, after eating a meal, the sensation of feeling full with a bloated stomach. In the small intestine, the same again. Collagen deposition leading to hypomotility and atrophy of the villi, leading to anaerobic bacterial overgrowth, causing malabsorption of the carbohydrates, fats and proteins. Wide-mouthed diverticula can also happen. That can cause leakage of bowel contents into the peritoneal cavity, causing peritonitis. In the large intestine, guess what happens? Collagen deposition, wide-mouthed diverticula and hypomotility. So how do we help her? The reflux esophagitis can be relieved by eating moist, soft foods, chew them well, and eat small, frequent meals. Avoiding late night meals, spicy or fatty foods, alcohol, caffeine, that all can worsen the situation. After eat, stand up for at least an hour, because gravity prevents food from entering the esophagus. Medically, we can give proton pump inhibitors, or it can go so far that we have to do a gastroplasty. For the esophageal strictures, we can use periodic dilation. Malabsorption can be prevented by suppressing the overgrowth of intestinal flora by tetracycline or other broad-spectrum antibiotics. What happens in the heart? The collagen deposition is the bad guy again. Here it can cause myocardial fibrosis, which is a scarring and weakening of heart, leading to cardiomyopathy, pericarditis with effusion, myocarditis, which is an inflammation of the heart, conduction abnormalities like the arrhythmias, which means that your heart beats abnormally. And it can go so far that heart failure happens. So as you have realized by now, collagen and fibrosis is the key words in this disease. So in the lungs, there will be interstitial fibrosis and intimal hyperplasia of the small pulmonary arteries that cause narrowing of the arteries, leading to pulmonary hypertension. Pulmonary alveolitis or pleuritis can also be seen, which is an inflammation of the alveoli and pleura. The patient will also complain about exertional dyspnea, which means shortness of breath, and it can even lead to respiratory failure and death. So it's very important, the patient and doctor watching for any signs of lung disease like shortness of breath, fatigue, swollen feet. But it's even more important to investigate the lungs with, for example, high-resolution chest CT scan, because these tests can find problems even before the patient notices any symptoms. For pulmonary alveolitis and fibrosis, we give immunosuppressants like methotrexate, azathioprine or cyclophosphamide. For pulmonary hypertension, we give epoprostenol, a prostaglandin I2, also called prostacyclin, which is a vasodilator. Or we give bosentan, an endothelin-1 receptor antagonist that blocks the vasoconstriction, usually caused by this endothelin-1. The musculoskeletal problems can be myopathy, which is a muscle weakness that can be treated with physiotherapy to help preserve the muscle strength. There can be arthralgia, arthritis, which is joint pain or inflammation. We can do tendon friction rub tests where we put a hand on the knees, for example, and try to feel a leathery crepitus during motion of the leg. And these friction rubs may develop over knees, wrists, fingers, ankles, and we treat the pain with acetaminophen, also called paracetamol, which is an analgesic, pain reliever, and antipyretic, a fever reducer. So we can use non-steroidal anti-inflammatory drugs for the inflammation. Physical therapists and an occupational therapist can help in preventing joint motion loss and to learn performing daily tasks such as lifting objects, opening doors, to put less stress on the tender joint. Flexor contractions may develop in the fingers, wrist or elbows. Carpal tunnel syndrome can happen in which the median nerve is compressed in the wrist, causing numbness in the fingers, for example. The kidney can be affected also, which is called scleroderma renal crisis. This is a malignant hypertension with acute renal failure. Malignant hypertension meaning that she got a sudden increase in systolic and diastolic blood pressure, and this leads to hyperplastic arteriolosclerosis, which is an intimal hyperplasia of the small kidney arteries that leads to fibrinoid necrosis and eventually renal failure, which causes death. A very important drug in this case is angiotensin-converting enzyme inhibitors, which have made this disease to be less dangerous as it used to be. Remember to measure your blood pressure frequently to detect any sudden changes and headaches or shortness of breath, because these are signs of hypertension. The main message that I want to share with you are that the skin is thick and hard and internal organs are affected, which is very dangerous and can lead to death. But how do we know that this is systemic sclerosis? We have to make a differential diagnosis because hard skin can be caused by many things. Scleroderma means hard skin, and it can be localized or systemic. Localized means that it only affects the skin and related tissues and no other internal organs are affected. Morphea and linear scleroderma are two examples. Morphea refers to local patches of scleroderma, and linear scleroderma, also called coupe de Sarre in French, meaning sword stroke, is a single line of thickened abnormal colored skin, which can be treated with cosmetic surgery. Systemic scleroderma, or also called systemic sclerosis, is affecting the whole body, including the internal organs, thereby the word systemic. And this is what the woman have in our case. The systemic can be divided into three types: limited cutaneous, diffuse cutaneous, and systemic sclerosis sine scleroderma, sine meaning without skin thickening. The limited scleroderma have limited skin involvement, often just the fingers, face, and the progression to visceral organ damage is very slow, meaning several decades. And there is a mnemonic for the symptoms of limited scleroderma called CREST syndrome, which means that we can see calcification, Raynaud's phenomenon, esophageal dysmotility, sclerodactyly, telangiectasias. The diffuse, on the other hand, have a rapid onset progression which occurs every 3 to 5 years. It is a diffuse generalized skin thickening affecting fingers, extremities, face, trunk, etc. This active phase have all these visual problems that we talked about, which is rapidly progressive and deadly. And after this active phase, it enters into stable phase, where the symptoms decrease a bit. But remember that thick skin can be caused by many things like diabetes, mycosis fungoides, amyloidosis, adult celiac disease, scleromyxedema, graft versus host disease, porphyria cutanea tarda, eosinophilic fasciitis, and many more. Even chemicals can cause scleroderma, like people working with polyvinyl chloride or epoxy, people taking bleomycin, which is a cancer treatment, or opioid painkiller like pentazocine, even people eating contaminated rapeseed oil or dietary supplements like L-tryptophan. So what we need to do is some lab tests to be more confident in our diagnosis. We'll find rheumatoid factors and autoantibodies like the anticentromere, mainly in the limited cutaneous, and antitopoisomerase 1, also called SCL70, mainly seen in the diffuse cutaneous. So to summarize, we can say that this is a middle-aged woman who has systemic sclerosis. She has abnormally high collagen production, which causes fibrosis all over her body, affecting the skin, gastrointestinal tract, heart, lungs, kidney, muscles, joint. So I ask you again, what would you do if your skin on your face started to become thick, tight, and your mouth narrowed to the point where you would look like a mouse?